I'm Dr. Suzanne Dawson. I'm an occupational therapist and clinician researcher. I work in the Caring Futures Institute at Flinders University and in clinical practice here in Southern Adelaide Local Health Network in the mental health services. This project is building on previous research that I've done where we found that weighted blankets were an effective alternative to PRN medication for people living with a serious mental illness. So this specific project is exploring whether weighted blankets are an effective and feasible non-pharmacological sleep intervention for people living with dementia.
At the moment with Bob we are using lots of medications and that sort of thing. So I asked for assistance with doctors and so forth in what was available because we'd been and seen some specialists. They'd suggested a couple of things. We started to trial those at home and it just aggravated the situation where instead of making him sleep, in actual fact it did the exact opposite. And just escalated the situation and it's still not working. So it would be really nice to trial something else in a holistic measure of weighted blanket and so forth to see if not only that it gives a security and so forth to Bob by being wrapped and that sort of thing, to give him that comfort and perhaps advantage of sleep without medications.
So we're conducting this research project at the Repat Neuro-Behavioural unit, which is a specialist dementia care unit in Adelaide for people with the most severe presentations of behavioural and psychological symptoms of dementia. The project's been conducted within everyday clinical practice, so we have a range of clinicians involved in that, including nursing, medical, occupational therapy and pharmacy. We're employing Lorraine, who is a senior occupational therapist here on the unit, to actually help facilitate the trial and data collection and analysis.
So when people with dementia experience sleep deprivation, then it means that the things that they are able to do are further reduced. It's very common to use medication to assist people with dementia to have sleep. However, the side effects can be quite problematic for them. It's generally recommended that we use non-pharmacological strategies. However, those can also be really complex. So for people with dementia, for them to make the most of the abilities that they have, they need to be able to receive enough sleep.
Weighted blanket it offers a deep pressure stimulation which decreases arousal and increases relaxation. So it's an option that could potentially help people both fall asleep and stay asleep. And people often associate positive meaning with weighted blankets, so they talk about feeling as though they're being hugged or held, which also increases a sense of security and safety. Sleep disruption can be a factor that triggers referral to other care places, including residential aged care. So we're hoping that this might be a solution that can be used both in the home but also by aged care staff as well. The funding from Dementia Australia Research Foundation is invaluable because it means we can conduct a rigorous project and hopefully be able to make quite strong recommendations regarding the effectiveness and how best to use weighted blankets in different settings. We're hoping that the outcomes of this project will provide a simple and effective sleep option for people that can be used in day-to-day situations in a range of different settings. Without the funding of Dementia Australia Research Foundation, we really wouldn't have been able to run this trial in such a rigorous way, and we hope that we have really meaningful outcomes that can be taken up by clinicians, people with lived experience of dementia and their families.